So Daniel, it's a great pleasure to have you here in Athens. You are one of the pioneers in the prosthodontic field. I would like to ask you some questions regarding prosthodontics. First of all, zirconia. Zirconia has grown into a quite big controversial issue. We have a lot of chipping of ceramics, a big rate of chipping. So what is, in your opinion, the indication of zirconia in dentistry, the future of zirconia in dentistry, and how could we possibly reduce the complications?
That's absolutely right. In the past, when we look at different studies, we had a lot of chippings, but never any problems with the framework. We have to really say that, to underline that. So its framework should be not the main problem. We need a little bit more space than metal, but however, if we look at the guidelines and fulfill all the requisites, I think the framework would be not a problem. We have in all the studies problems with chipping. There are one or two ceramics studies which shows normal chipping rate, but we find a lot of minor chipping and 1/3 approximately major chippings as well. And we have a lot of covariables influencing this chipping problematic. For the future, I see that there will come even new alloys, let's say alloys for ingredients for the frameworks, but the main problem, the chipping problematic, will be solved, to my opinion, by digital veneering. So there are different approaches by Vita, rapid layering technique, RLT. There's DVS, digital veneering system from Lava, which creates a higher homogeneity of the materials, and it's more standardized processes. And there's another approach called CAT-on, where you are using lithium disilicate ceramic for the veneering procedure. This version, the last I described, comes from our university, this idea. And in our studies, in vitro studies, and the first experience of our in vivo studies show that we have zero shipping rate anymore. Therefore, I'm relatively optimistic with some new technique that we get it into, we can solve this problem. Not for the anterior aspect, there we need more aesthetics and still the skills of the laboratory technician, but for the posterior aspect, I think. The other aspect is, of course, occlusion, but those are covariables I will talk about. Yeah. It's the material itself, which is important.
Mm-hmm. Daniel, during my last visit in Cologne, in the IDS meeting, we have seen digital impressioning. So what is your opinion about digital impressioning? Are we already looking about a substitution of the conventional impression techniques?
So actually it's nothing new, because intraoral digital capture we know from CEREC already since 25 years. But now all the companies are really looking for this type of technology. What's the problem? Do we have a lot of problems with conventional impression taking? Yes, we do partially, of course. We can avoid it. For me, it's a very clear component of the whole CAD/CAM process to generate a digital workflow. So why starting from the gypsum model? We can directly start in the patient's mouth, and therefore we can avoid a lot of problems. We need not disinfection. We can also send the data all over the world. We have also not an expansion of the gypsum with a lot of steps which can contain any failures as well. So this is one argument. Regarding the technology, there are different approaches like active triangulation, wavefront sampling, and confocal principles. Mm-hmm. Confocal principles give us the opportunity to take impression powder-free, which is an advantage. So there are different approaches, and I'm very curious which one will be the best. However, the question was, will they replace analog impression? I think partially yes for the next years, that's for sure. I see some major problems still in full mouse, full arch digital capturing, because they have to match certain segments and then you can have a distortion horizontally, vertically. And I see it more for smaller application, and in the when you look to the horizon, I see more and more they will take over. There are enough reasons for it, and our first measurements that we have in vitro, I can definitely say we can accomplish or reach a higher level of precision, of accuracy.
I saw you during your lecture in the morning. You said about the importance of being conservative in our preparations. But sometimes we are preparing and we are indenting. So what is your opinion? What do you feel about bonding on dentin? Do you think that this could minimize the long-term prognosis of restoration, such as veneers and onlays?
Yes, definitely. I always would prefer confining the preparation within the enamel shell. That's one important point. So the more dentin is exposed, we see that in different studies, the longevity of the restoration will be decreased. You can see that in clinical studies, you can see it also confirm that in vitro studies. But however, by approaches like dual bonding or immediate dentin sealing, there are different approaches, we can increase this bond to dentin, and more we are using these technologies to increase a little bit. We have also some, of course, developments, improvements in dentin bonding in the past. But however, that's the same. We have to consider as a general practitioner that the more bonding is exposed, the longevity of the restoration will be decreased. And it's a very important point for the indication, which kind of retentive or less retentive material or restoration should we select. And therefore, yeah, I would really say it's an important parameter for estimating the longevity of your restoration. It's still inferior to enamel bond.
In your everyday practice, when you are indenting, do you always use a dual bonding technique or immediate dentin sealing according to Magnet? Is it what you do in your everyday practice?
No, it's not, to be honest. It depends on the amount of dentin. If it's only a certain small area, I leave it like it is. If it's an important part of the whole retention, I would do that. And I would follow the protocol. I would also activate the surface prior to the final placement of the restoration. Even in certain application, I would silent it after silicoating. So this is the highest level of bonding at adhesion in these cases. And since we have more and more retention-less restorations, we need every square micrometer of adhesion, and therefore I would use this in those applications.
So, and Daniel, thank you very much for giving us the opportunity to have you here and to give us this interview. And I'm looking really forward into cooperation between our two universities, the University of Munich and the University of Athens. Thank you very much again.
Would be a great pleasure for us, and we always like the exchange of students with other countries, because we improve our quality by that, our input, our perspectives. Yep. Thank you very much.
Thank you very much.